All right, choking. So the universal sign of choking is somebody grasping at their throat. If you see someone doing that, then anywhere in the world, that's a universal sign of choking. So you're going to ask them, "Hey, are you choking? Can I help you?" Right? So if they say, "Are you choking?" They say, "Yes," then they're not choking. Right? Someone who's choking, they can't breathe, they can't speak, and they can't even cough. They're grasping at their throat, they're turning colors, right? So those are the signs. So we have partial airway obstruction, right? Where you have a mild cough, coughing forcibly, or a severe partial airway obstruction where it's weak, ineffective cough. In that case, we're going to encourage them to cough. Keep coughing, keep coughing, keep coughing. We're going to encourage them to keep coughing, but hey, say, hey, cover your mouth though. Cover your mouth and keep coughing. All right. So then if there's a complete blockage, then they're not going to be able to speak or breathe, right? You see that? And then common causes is the tongue. The tongue's actually the most common cause of someone choking when they're unresponsive. But when they're conscious, vomit, foreign bodies, food, swelling, spasm, those kind of things. Hot dogs. All right. So then all right, so let's look at for preventing choking. If you're trying to prevent someone from choking, then it's good to just avoid all those choking hazards to begin with, right? So cut food into small pieces, reduce alcohol consumption while you're eating, right? Avoid talking and laughing while eating, avoid physical activity while you're eating, and keep objects out of reach of children. So if you were to cut the bag of milk and cut the end off, then that little piece is something that kids choke on all the time. So make sure when you cut that, you get it right away and throw it in the garbage. Also, the ties that go on top of the bread, all of those can be choking hazards. When you're cutting a hot dog, don't just chop it this way, right? But cut it long ways and then chop it. And that way the little rings are just perfect for choking. So if we cut it this way and then chop it, then we're getting smaller pieces, and that's better if you're going to feed your kids a hot dog. All right. I don't think my little guy's ever had a hot dog before. But yeah, if you're going to choose that, then make sure you're chopping it into small pieces. All right. So when we're dealing with choking, we need to work on an adult, a child, and an infant. So the technique for conscious choking is pretty similar, and the choking for unconscious choking is very similar as well. So when an adult is standing and they're showing the universal sign of choking, you're going to say, "Hey, are you choking? Can I help you?" And then if they motion yes, that means they can't speak, right? You're going to lean them forward. So flex them down to 90 degrees as far as they'll bend forward and hit them on their back 5 times. Okay, then you're going to tell them stand up because they can still hear you, and you're going to find the top of the hip bones, come right where the belly button is, just roll up and make a fist and cover over and thrust in and up, in and up. So you're going to do that 5 times, in and up, in and up. So it's 5 back blows, flex forward, 5 back blows, then stand them up, and 5 abdominal thrusts. Okay, so that's how we're going to deal with an adult who's choking. And you're going to continue that until they get better, the food pops out, or they get worse and they go unconscious. Okay, so those are the 2 options. They get better, the food comes up, and they start coughing. You encourage coughing. But if they go unconscious, we're going to lower them down to the ground. You can let their bottom hit the ground, right? You have a lot of good padding back there, but you're going to support where their spine and their head is to the ground slowly, and then we can go into our unconscious choking procedure. Okay, so let's deal with conscious first. So for the child who is conscious and choking, they're going to be a little shorter, so we have to get down to their level. So you're going to get down on one knee. Okay, you're going to get down on one knee, and you're going to hit them on their back and do abdominal thrusts. So exact same as the adult, but you're just doing it with them, you down on one knee because they're shorter. Then when we look at the infant who is conscious and choking, we're going to grab them by the jaw, angle them down, and 5 back blows. 3, 4, 5. 5 back blows, and then we're going to roll them onto the other arm and do 5 chest compressions. 3, 4, 5. We need to keep repeating that back and forth until they get better or they get worse. Okay, so that's our conscious choking procedure. All right, so we'll have a chance to practice all that, but then let's deal with the person who now has gone unconscious. So if they go unconscious, we'll lower them down to the ground. Infants, we can work on the table, and we are going to do our basically CPR. So as soon as anyone goes unconscious, we need to call 911. Okay, so we'll call 911 to get that procedure started, and the unconscious choking procedure is almost exactly the same. So as soon as they go unconscious, we call 911. Hey, call 911 and grab a defibrillator. Okay, so now we can go into CPR. We're going to do 30 compressions. We did those 30 compressions to try to pop the food out. So the food's stuck here. We're doing 30 compressions to pop the food out. Right? So after you did 30 compressions, let's look in the mouth to see if we actually popped it out. And if you see it, then you pick it out. Okay? If you don't see it, don't put your fingers in the mouth. That sounds common sense, right? But you know the guideline before? We used to do blind finger sweeps, just sweeping in people's mouths, traumatizing the back of their throat all the time. So we do 30 compressions to try to pop the food out. Look in the mouth to see, did you see it? And if you see it, pick it out. All right, then we need to try our 2 breaths. So we're going to open up the airway, put our breathing barrier in place, and give a breath. And if the breath doesn't go in, then we assume the first time is your fault. First time is my fault. So maybe I didn't, on the adult or the child, I didn't open up the airway enough. So I'm going to tilt it back even further and try another breath. And if that doesn't go in, then I know that they're still choking. So the first time is my fault. The second time, they're still choking. So I'm going to go back to 30 compressions. So 30 compressions, I'm going to pick food out. I'm going to try 2 breaths. 30 compressions, pick food out, try 2 breaths. 30 compressions, pick food out, try 2 breaths. Over and over again, pick food out, try 2 breaths. 30 compressions, pick food out, try 2 breaths. Over and over again, pick food out, try 2 breaths. Over and over again until finally you can do those 30 compressions. You can pick some food out and you give a breath and the breath goes in. So the food is gone and the air actually goes in and the chest rises and now the air comes back out. When you can actually get a breath to go in and come back out, you know that they're not choking anymore. That's amazing. So then you're going to give 2 successful rescue breaths. The breath goes in and it comes back out. And now you know that A, the airway, is clear. But don't celebrate too soon. What about B and C of the A, B, C? So airways open. What about B and C? Now we go back to our original assessment where we were checking breathing and circulation, and we would determine whether they're breathing. Instantly when you get that food out, they should start breathing. And if they do start breathing, you're going to roll them onto their side into the recovery position. All right? That's what we would do for the adult and the child. So the only difference on the infant is how you adjust the airway. Because remember I said if you open up the baby's airway too far back, then you're actually going to kink the airway. So sometimes you open up the airway too far and you kinked it and they're not really choking, right? So we're going to, as soon as they go unconscious, we're going to call 911 and start into CPR. Right, on the infant, and then we're going to do 30 compressions, pick food out, and we're going to try a breath. If it doesn't go in, on the infant, we're going to go more neutral position, so more neutral, and try a breath. Where the adult and child, we went back further. All right, so that's good. So that's the only difference. 30 compressions, pick food out, try 2 breaths until finally you can get those 2 breaths to go through. And if the 2 breaths go through, you know A, the airway is clear. Then what about B and C? Let's check breathing and circulation because it's possible that they actually died during this process. The food choked them out, so they went unconscious. Then the food kept choking them out until their heart stops. All right, and then finally you get the food out and determine their airway's clear, but now they've actually died. They're clinically dead. They're not breathing, right? They don't have a heartbeat, so this person is clinically dead. So if someone's not breathing, that's bad. We need to start CPR. So if we get that food out, the airway's clear, now we're doing CPR, and this is when we can add in the defibrillator. Okay, we didn't use the defibrillator when they're actively choking. All right, but with these guidelines, if they are, as soon as they're not choking, then we can assess them, the B and C, and check to see that they're not breathing. So now we can add in the defibrillator. So if the defibrillator is there right away, put the pads in place and then shock them. if it says shock advised, and then we'll move into doing compressions, 30 compressions and 2 breaths, 30 compressions and 2 breaths. All right, so this is the longest scenario in the class. We're going to do a conscious choking procedure, then down to an unconscious choking procedure. We're going to do that on the adult, the child, and the infant. So this is an important skill because I know this is one you're going to have to deal with at one point in your life. So I want you to really focus on this one. So let me run it from top to bottom and show you what I expect from you.